like no water pressure. Internet didn't work. I mean, we made the best of it, but dude, it was a rough trip. And then yeah, dude, I went to Marcus King last night. I had to leave a little bit early because the kids were getting antsy, but we still didn't get home till like 11:30 because they start so late. But I'll say, dude, he put on a hell of a show. I was out there with my dad, Uncle Tommy, my little sister, and Emily. We all went out there. He's just fucking getting after it, dude. The opening act was good. I had a buddy that I've been doing like a week of training at work, right? And my buddy, from this class, we had just kind of been talking. He said, "Oh, I'm going to see Marcus King tomorrow." I said, "Oh, well, shoot me a message when you get there. We'll link up."
Yeah.
So we linked up at the beginning, had a beer or so, and was like, "All right, I'll catch you later," whatever. We parted our ways, and I was with the family. So we went down to the floor, everybody's dancing, enjoying the music, having a good time. And I turn over, dude, he's right there. It was like the craziest thing that happened in this concert full of all these people. We were at the same exact spot. And he texted me today a funny story. So, like I said, we left probably halfway through the show to go home to the kids. But he texted me, he's like, I hope your night went well, man. Did y'all have fun and all this? He said, had a little crazy altercation. And I said, well, what happened? So he's out in the crowd, right? And the drummer boom, throws a drumstick into the crowd and he catches it. He said a group of people were like filming him, and like one of their buddies comes over and snatches the drumstick out of his hand, like trying to do like a prank video or whatever, and then he takes off. He starts running out of the venue.
Did he chase him?
Yeah. He said, all he said was, yeah, these guys snatched this drumstick out of my hand and took off. I said, well, what happened? He said, I chased him down. So he chased him down through the venue and tackled the guy and got the drumstick back.
Oh, man.
He left after that. I was like, holy shit, dude.
If I can give him a smack on the head with the drumstick.
Yeah. He's like, I'm not going to have some TikTok crew rob me of a drumstick.
That's crazy, man. But, dude, I'm pretty jealous. I want to go see him live bad. And he's from here. He's from Greenville.
Yeah. Dude, he was
getting, something.
He was like, he was preaching up there, dude. He was giving it all he had.
Yeah. Yeah, that's probably awesome.
So let's get into the show, brother. What's the game plan today? This fine Saturday evening.
Yeah, we got a good one. Okay, so it's coming in right now. Humberto is over there on the desktop. He said she's ready to go, so we're gonna get her in here. But this is a big one. This is our second doctor that we've ever had. The first one we had on diagnosed you with psychosis, and we had to scrap the whole episode. So maybe we can get this one posted. My sister coming on. She's giving us a little bit of time this evening to talk about her line of work. She's in the operating room, bringing babies into the world, working hand in hand with the stork. And I didn't know how any of this stuff worked until I found myself in that room myself. And I was impressed with the doctors that we had. And so it's crazy that she's doing that.
Yeah, dude.
Tonight.
I'm looking forward to having this talk and seeing. Like you said, I've been in that room myself, and the most nervous I've ever been in my life. Definitely, both times. And the OBGYNs can make that whole thing 1,000 times better, and you're really relying on them. So I'm excited to see it from the other side.
Like stone.
Yeah. Well, let's go ahead.
With a limp and Dave with a cough, swearing they once rode the devil right off. They talk about the day when the sky turned red. They rode into town with a price on their head. Walked through that bank with the coldest of eyes, left with the gold and a trail of goodbyes. They never got caught, they just drifted away.
Did you know,
Two
right
names
starting college,
whispered
did you
at
know
the
that you
end.
wanted to be an OB?
Not that I wanted to do OB, that I didn't decide until like in the middle of medical school. Um, when I started college, I knew that I wanted to go to medical school, and I knew I wanted to be a doctor, but I kind of, I don't remember exactly when I decided that's what I wanted to do, but I know that's what I started off wanting to do when I started college. And then I had a few moments over um, those 4 years, like at the beginning, where I kind of, went back and forth, like, is this really what I want to do? There's so many other things to do. And I think it's just hard for, when you're 18, 19, 20 to be like, what am I going to do for the rest of my life? And it just seems like
Mm-hmm.
there's so many options and so many things that you can do. And so I definitely had a few moments where I was like, oh, I don't know, maybe I want to try something else instead. But ended up like kept coming back to that. And
Mhm.
so even when I thought like, oh, maybe I'll do something different, something would happen and I'd be like, actually, no, this is what I want to do. But I didn't know at that time like what specialty I wanted to do or anything like that. It was like still seemed like I wanted to keep my options open and like learn more about kind of everything before I decided.
Yeah, I know you and, um, well, for the listeners that don't know, your husband is also a doctor. So I've
Hmm.
talked to you both a good amount about this kind of stuff, and just there was a good amount of people that kind of maybe did 5 years or 6 years and then realized it wasn't for them, or they couldn't cut it.
Hmm.
What and this is coming. I only did 3 years of high school, and I dropped out of college like 3 or 4 times now. So what how did you stay motivated to keep pushing through? Like, was there anything pushing or pulling you in that direction?
I don't know necessarily. I think every time I would think like, oh, I don't want to do this, then because I was doing a lot of like volunteering at the hospital and like shadowing different doctors and stuff like that, because that's like part of your application. You have to do all these other things to like show like you've have an interest and like have looked into medicine and stuff like that. So I just feel like every time I would go back and like shadow somebody or like be in the hospital, I would just like feel like, okay, this is where I am supposed to be and this is where I want to be. Um, but then I would have those moments too, like you said, like people sometimes get into it a few years and realize it's not for them. And that was kind of daunting because it's hard to, especially the farther you get in, like once you start medical school and then like especially like starting residency, like it's hard to back out at that point, like because you've just put so much time into it. So it's hard to like start over with something different, or you just have so much money in loans that you're like, well, now I have to follow through and finish,
Yeah.
because I've already put so much money into it. But luckily, of course, there's been days where I think like, oh, I'd want to do something else, or like I, you know, wish that I had done something else. Like I think all of us have those days, but for the most part, I haven't ever wanted to like actually be done.
Yeah. What You mentioned before, like it's daunting being 18, 19-year-old trying to decide what you want to do for the rest of your life.
Mm-hmm.
And I mean, it's still, uh, I'm 31 years old.
Yeah.
I'm figuring that out for myself. And that's why we started a podcast. We can just break down other people and
Mhm.
we never have to figure it out if this thing works.
Mhm.
But what, why did you want to be a doctor initially?
I don't know. I can't.
Paycheck?
No, because a lot of people will say, like I've heard that before. Like a lot of people think like, oh, if you are a doctor, you'll make a lot of money and whatever. But there's so many
Mm,
other jobs where you can make even more money and have less loans and get to that point sooner. Like I have been out of residency now for 3 years. So it didn't actually start like making what would be considered like a good paycheck until 3 years ago. But it's like, 12 years of commitment of living like a student and then racking up all this, hundreds of thousands of dollars in loans. So if you're going to go into it for the money, there's so many better options.
mhm.
If like your main goal in life is to pick a job where you can make the most amount of money, this would not be the smart move, I don't think. Um, I don't really know. I was trying to think of that recently. Like, when did I decide? And I feel like I was just always interested in science. Like, those were the classes that I really liked. I liked biology, I liked chemistry. And so I was kind of like leaning more towards sciences. And I, wanted to do something like working with people. I don't think I could see myself like just doing like working in a lab or something like
Yeah.
that, or doing like just research. I just couldn't really see myself doing that. And I just felt like science and like medicine was just very interesting. Like all the things that can go wrong with a human was just really interesting to me, and like all the different ways that you can fix the things that go wrong. And um I don't yeah, so I can't remember exactly like when I decided. It's just something like I kind of always remember thinking about.
And with your schooling, I remember you talking to me about if you could explain this to us further. Well, drink them if you got them. Hopefully, there's no
I
babies that are needing delivery tonight. But you had talked to me about something with your schooling was like a slight, almost a different approach.
Yeah,
Maybe more like a holistic medicine,
yeah,
like you said, trying to fix the person and um not just like throwing a medication
yeah.
at them.
Um, that's kind of, so there's two. If you go to a doctor, you'll see like the letters after their name, and there's two different degrees that you can get to be a physician. And so there's like
Mhm.
MDs are the most common, or medical doctor, and then
Mhm.
DOs are Doctor of Osteopathic Medicine, which is what I am, and my husband too. We met in school. But so DOs are not quite as common, but you will see them very frequently if you like pay attention to like looking at doctor's office, like the names on the wall and stuff like that. You'll see them almost everywhere. But so osteopathic medicine was started, I think, I want to say like 1870, 1880, something like that. This guy, he was a doctor named A.T. Still, and he created this other kind of like um,
Framework.
philosophy about medicine, like more of like a holistic approach versus like just treating the disease. His philosophy was treating like the whole person and like mind, body, spirit. And like if you can treat all of those things, then you'll heal people better than if you just treat the disease. And then with that, he had what is now like referred to as osteopathic manipulative medicine. Oh yeah, there he is.
There he is.
There he is. So I don't know. I'm probably saying a few things wrong. I don't know the all the history behind it, but so
Our
he
listeners aren't going to know either.
yeah.
So
Um
you could tell us
you can
anything.
fact check me later, but he created this like other kind of offshoot of traditional medicine at the time, and created like the first DO school, which is this in Missouri where I went to school. And then since then, other DO schools have popped up around the country. I don't know exactly how many there are. Um, but part of that's a little bit different now. And I feel like over the last century, like the MD and DO routes have become very, very similar. Like there's really not a
Mhm.
ton of difference. The things that are different with like going to a DO school is you learn the osteopathic um, manipulation or OMM. That's kind of like different like ways of like physically treating someone with like it's almost like chiropractics, but a little bit it's quite a bit different. And the person who actually started chiropractic medicine was a student at AT Still, like in the early, either late 1800s or early 1900s. And then he kind of took some of what he learned and created like uh, his own thing. And that's where chiropractics comes from. So it's kind of similar to that, but now people, um, can they go to the same residencies? Like the residency that I went to is like traditionally an MD residency. So out of my class of we had 8 residents a year. I think I want to say 2 of the 8 of us were DOs, the other 6 were MDs. Actually 3, no, 3 out of the 8. So, we kind of go to the same residencies, and I don't practice really any differently than my MD colleagues in my specialty, but there are some DOs who do more of that OMM or manipulative medicine in their practice, or like specialize only in that. So you can see those physicians as well. So um, it really just depends on kind of what specialty you are and how you choose to practice. And a lot of MD, I would say like most MD schools too, are like people try to focus more on like holistic approach to medicine. So like the two philosophies has kind of merged since it started. So I wouldn't say there's a huge difference in current time.
So is like the main start of the DO is like basically because I like the idea of like how it sounds,
Mm-hmm.
but it's like maybe like you say somebody has like um I don't know, like a breathing or a a problem, something like that, instead of just like here's the medication for it. It's like no, if you do these things daily as well, like you will improve over time
Mm-hmm.
to get off the medicine. Is that kind of what
Yeah.
it is?
Yeah, like focusing more on like to preventative health, to try to prevent any further complications for people, or just seeing people for like their annual exams and stuff like that, and talking about, family history and some different risk factors they have, and trying to prevent disease. But I would say, MDs do that as well.
Right.
So it's not, like I said, it's not as big of a difference in practice style, I wouldn't say. Kind of, depends more on the person too. But yeah, kind of more preventative health, and then also taking into account like kind of with the holistic approach to medicine is like you can't treat everybody with the same disease the same, because
Right.
different people have different lives, like different people can sometimes have access to different treatments, whether that's because of where they live or finances or ability, like for transportation, for different things. So there's so many different factors when you're like treating a person, that you can't always, like, you have to take into account like the other things going on in their life too, that can sometimes be different person to person for how they can receive treatment, or what else they have going on as well.
Yeah, that's really interesting. I've seen it. I was an EMT right after the military
Oh,
for a little bit,
that's really
and
cool.
yeah, so I'd see, at the hospital, I'd see
Mhm,
those two differences, and
mhm.
I never knew. So it's
Yeah.
pretty interesting to
Mhm.
actually know where that all came from.
Yeah, so it's more, I mean, there are DOs who do practice very differently, like I said, with like some of the manipulation techniques, which are very useful and like really cool. And they're like very skilled at those things, but I think right now that's not like necessarily the majority of DOs. That always do those things. Like I don't incorporate that into my practice right now. I think it would be nice to be able to, especially for like treating pregnant women that have a lot of, back pain and hip pain and things like that, where those techniques could be useful, but unfortunately just like don't have the time in like our visits and with everything else that we have to do, at least in my practice, to be able to do those things. And so I
Mm.
have not like kept my skills up with, even though we learned all of that in medical school, have not necessarily kept up my skills in those things.
Yeah, I was gonna, and this might be jumping ahead, but I was curious about that. Like, what, um, I guess you'd say OMM techniques would you implement for pregnant women? But you kind of touched on it, like maybe a lot of the pain management.
Hmm.
I remember with Lauren, it was just back pain and I mean pain everywhere.
Yeah, everyone.
Real quick, Dave, your mic's a little low. I don't know if
Yeah, I
that's
didn't.
just on my end.
Yeah, I it's definitely quieter for me too.
Now I can't hear you. I think you turned it all the way down.
Is that?
Yeah, there you go. There you go.
Oh, yeah. Well, Humberto, you're gonna have to fix this afterwards. We got these fucking guys working here that we're trying. We're trying to figure it out. But so when like it's easy for us to kind of relate things to the military where we had a blanket job, the infantry, and then you kind of go through a pipeline, and then you pick eventually you kind of have to pick your specialty, whether machine guns or rockets, whatever.
Hmm.
How does that work with medical school? Like, at what point do you have to say, I'm going to choose this route?
So you start applying. Feel like it was like such a stressful time and like such a blur. I'm like forgetting what the timeline was. But you start applying at like in between your third and fourth year. So medical school is 4 years, and some schools are now like switching up the curriculum to be a little bit different than it has traditionally. But like when I was in school, and what a lot of schools still are, is like the first 2 years of medical school are all classroom. And then the second 2 years are all clinical. So then you're actually like in the hospitals, in clinics, like and doing your rotation. So you rotate through like the main specialties: internal medicine, pediatrics, general surgery, emergency medicine, like OBGYN, all of those things. Like you'll be there, 4 to 8 weeks at a time, depending.
Oh, wow.
And so you get kind of, you learned everything in the classroom, and then you're like now in third year learning kind of like in with real patients.
On the job, like shadowing.
Yeah, mostly for a medical student, it's mostly shadowing. I mean, you would like see like typically the way that usually it's set up like in a teaching hospital is that like the medical student would go in and like see a patient, get their history, do a physical, and then like you come out and present it to your team, which is usually, like residents, and you're attending. And then sometimes the resident, it would just kind of depend on, sometimes you would present to the resident and then it goes like up the chain to the attending. Um, just kind of depended how like the service was set up. But you would like present your, your history and physical, and then like come up with your assessment of the patient, and then your plan, what you want to do. And then, everyone would kind of like the residents would then, give feedback and tell you you're completely wrong, or like should also do this or whatever. So usually like medical student is like you're kind of trying to practice like diagnosing patients, coming up with a plan for what you want to do for that particular case, and then just shadowing, learning, watching what everybody else is doing. So that is, third year, you're rotating through, and then you get at least at our school, and I think most places, at the end of your third year, you have some electives. Because there's so many specialties and like subspecialties in medicine that like you can't possibly see all of it in 4 years. So you can pick like to do some electives of like things you might be interested in, or like something like you want to do again if you're like, I kind of like this. So then at the end of your third year is usually when you're deciding what specialty you want to do, and then you apply for residencies between third and fourth year. So you send in applications, and then you get interviews like starting end of that summer into the fall, winter of your fourth year. So you're still like in the hospital doing clinicals, doing rotations, but you'll be interviewing for residency programs. And then you're interviewing for programs in whatever specialty you are deciding to do. Some people will sometimes apply to more than one specialty for various reasons, but most people will just apply to one specialty. And then when you are done interviewing, wherever you've interviewed, say you interviewed 10, 15 places, you rank those places 1 through 10, or however many interviews you had. And then the programs are also ranking their candidates who they interviewed. They might interview like at our program, I can't remember exactly. I want to say we'd interview like 100-ish people, maybe 80, 100.
Oh, wow.
That might be completely wrong, but it was quite a large number of people we would interview.
Do people know where did you know what your ranking was
No,
back then?
you don't know what your ranking is. So then like, once I was a resident, I got to see the other side of it, of like how the program is ranking people. And it's really interesting, and it's really like, it's so subjective, and it's really like all the residents are in a room, and you put like how we would do it, and I think how most programs, from what I've heard from other people, do it very similar. Like all the residents and several attendings and your program director are like in a big classroom, big room, and you put up like somebody's picture on the projector, and everybody would just talk about like, okay, they're, and by that time, like if you've gotten to the point of interviewing, like everybody's very similar as far as like if whatever your program and specialty like will have kind of a, you need this kind of like minimum test score, this minimum board score, grade,
Mhm.
whatever, letters of recommendation. So like by the time they've gotten to the interview process, like everybody's pretty similar of like the group of people you're interviewing. So then it's
Yeah.
more so it's just like, did people like them at their interview? And sometimes it's like as stupid as like, somebody just didn't like the way they said something, or like somebody rubbed them the wrong way, and then it's like, okay, well, they're going to go to the bottom of the list. Or
Mm.
somebody like they really, one person in the room might say, you know what, I sat with this person at lunch, and like we really connected on this, and like I really like this person. They go to the top of the list, like if somebody kind of vouches for them. And so
Wow.
it's really, I mean, there's not.
So personality
Yeah,
can
then
really.
it kind of comes down to personality, and it can be, if somebody just didn't interview very well, or, something, and it's like kind of it's it's like um going to change the course of somebody's life if they
Yeah.
match into like the specialty they want to match into, or the program they want to match into. And so, then we would rank all the candidates 1 through 100, and then when you're applying, you rank your programs, and then it goes into this like computer system, this like algorithm that matches, like it tries to match people with like your highest choice. So like if the program ranks, you as number one, and you ranked them as number one, great, you're a
Mhm.
match. But if
Mm.
you ranked them and they didn't rank you, like it goes down to the next person. And so it's a very complicated process, and like a lot of it is so up to just luck and chance, and like the right
Yeah.
person kind of vouching for you at your interview. Um, and
That seems so stressful.
it's very
Yeah.
stressful, and a lot of like really good candidates every year don't match into the specialty they wanted to do. And I got very lucky that I matched into the specialty that I wanted to match in. But a lot of people, don't, or like don't match into the programs they want to match into, and it really like can change the, course of your life.
And what happens? Say
So if you
if you.
don't, say you don't match to any of the programs you ranked, then that week it's like National Match Week. That week is like they call it the scramble. So then you log on,
Like, oh, my
um,
brain.
and we had some good friends in medical school that were like very smart, very good, like are now like really great doctors that didn't match. And so I remember like them going through this, and they had to log, there's like, then you log on, and then there's a list of all the unfilled places. So like
Mm.
some programs will go unfilled, and then it's literally a scramble to try to grab a residency spot anywhere in any specialty, like
In any state too,
any
right? Like,
state, any city.
wow.
Um, we had a friend in med school who had I think he also wanted to do OBGYN, and did not match, and ended up in like an internal medicine residency, and now is an internal medicine doctor, which is totally
Mm.
different than what he had applied for. Um, and so yeah, I mean, you could end up in a you could choose a specialty, and like, this is what I want to do, this is what I love, and
Mhm.
then end up not being able to do it.
It seems
um
pretty unfair
it
too. You've
is
invested all that time and money into it to
it
just
is
get a
it's so
personality thing and somebody say, "Yeah, you're not going to do that."
Yeah, I mean, sometimes it's by the time you get down to the interview process, it's typically, a personality thing. But there's some other factors too. but then like the point of like to get to the interviews, and some specialties are much more competitive, like my husband's a radiologist, and that's a very competitive specialty. And so like to get an interview at like a radiology program, you have to have a much higher test score than some other specialties. So like that kind of can play a role into like what you're able to do as well.
And once you get into the residency, you're saying like there's all the training and things like that. It's a lot of shadowing. I
Mhm.
don't know if you've talked to like any doctors that have just gone through or anything like that, but I always think especially in medicine, I feel like you can't see everything that's going to happen, or you
Mhm.
can't train or shadow or see it. Have they done anything with like, virtual reality or like simulations that where like you are kind of presented with these things that you might not see once,
Mhm.
every couple years or
Yeah.
something, and how to navigate that?
You
Yeah.
mean, yeah, like if for you mean like for you can't tell if someone how they'll do under pressure
Right, that, and like,
just on
let's say
paper.
there's like this crazy complication that rarely happens and they present it to you so that way if it happens as well, kind of more comfortable of what to do.
Mhm. Yeah, we do a lot of like in medical school, we did a lot of simulations. And then as residents too, we did a ton of simulations for different like OB emergencies and things like that that you don't see super often. So yeah, I would definitely do a lot of simulations. Um, but the like learning curve from going from a med student where you're like mostly kind of shadowing and like in the corner and like just watching what other people are doing. I mean, you're still like we would get to assist in surgeries and like kind of, be scrubbed in and stuff like that. But really like the med student's job is not very important. You're there mostly to observe and to learn and kind of soak everything in. And then you go from that to like day one of residency, you're like thrown in and now you're doing everything. And like you have attendings there and they're, you're running things by them, but especially,
Can you explain attending just
yeah.
for
Um,
people listening might not know?
Yeah, so the attending is when you finish residency. So you're done with all your training. Now you are like the end of the line in like in a teaching hospital, you're the boss. You're the person that the residents
Mhm.
are staffing with. You're overseeing the residents. Some places don't have residents or medical students, but um they're to practice on your own without anybody overseeing you, you're the attending. So someone who's finished their residency training.
Did did you was there ever people I'm sure it has to happen that they go through the entire medical school and then maybe they just can't get a job. Like,
Um,
is that common or
that is not super common because there's a doctor shortage across the country.
oh really?
And that's the other, I mean, it's a very complicated process with residencies and all of that because there's like we were talking about how people don't match into residency spots. there's not there's less residency spots than people who are applying for them, but we have such a doctor shortage that like we should be training more doctors, but there's not. Residencies are funded by um like it's like a government funded education um, process. And so, like, to open up more residency spots and train more doctors, you need more funding. But then we have just a shortage of physicians across the country in almost all specialties, especially primary care. OBGYN is something that's very short as well. So like you can find a if you complete a residency program, like you're going to be able to find a job. It just may not be where you want to. Like you may have a harder time finding a job like in Chicago or New York or somewhere that's like really saturated where people want to be. But
Yeah.
you can find a job somewhere. It just might not be the location you want or the setting you want.
You were talking about that transition from kind of observing to being thrown into it. I'm sure that's extremely stressful
Yeah.
too. And are there some people that like do that, and when all the pressure's on them to make decisions, so like, actually, I don't want to do this, and they kind of back out of it.
Um,
But
yeah,
that's also probably pretty tough because of, like you said, the amount of time and money
yeah.
invested at that point.
Yeah.
You can switch specialties, so that has definitely happened. Um, like in my residency program, I don't think I'm trying to remember. I don't think there was anybody in my like when I was actually there during training, but there was somebody in a class a couple years above me. So she was already like had switched before I had started, but she started as a OBGYN resident. And I think only a few months in was like, yeah, this isn't for me. This is not what I want to do. And she ended up, I think, switching to like a psychiatry residency. She was
Oh
able to
wow.
get a spot in a different program. So people do that. They do switch specialties. I wouldn't say it's super common, but it does happen.
Yeah.
But then it's also sometimes difficult to then get a spot in, you know, a program that you want, but it can happen.
Okay.
We when we have people on the show, we try to it can be hard to just talk about yourself the whole time.
Yeah.
So we also want to give opportunities for you can highlight other people,
Mhm.
and something that I'm curious about when when you were more in the spectating role, kind of jumping through all these different fields. You said it was about 4 to 8 weeks in different fields, but was there ever anything like, especially in like emergency medicine, where you were kind of just in the corner watching and you saw some doctors just that impressed you and did something, impressive to help a patient?
Um, yeah, I mean a lot of different things. And I remember as a student I rotated at I was actually doing an anesthesia rotation, but it was at a trauma center, and the anesthesiologist that I was with was he was like uh, on the that day and would have different days where he was like covering trauma.
Mm.
So whenever like a trauma comes into, you know, they first roll into the emergency room, and then usually it's a group of people. As far as like physicians, like an anesthesiologist will often be there because if the patient needs to be like intubated or given sedation or anything like that, they will kind of cover that. Emergency doctor, of course, and then like often, you know, depending on the trauma, like the trauma surgeon or general surgeon. And then sometimes there's OB patients that, you know, get in car accidents or other kinds of trauma, and like we will get called to the trauma bay occasionally as well. But I just remember being a student, and I can't remember the exact situation, like what this person, I don't know if it was a car accident or motorcycle accident or what it was, but I just remember, you know, I think it was like the first trauma that I had seen, and just seeing like how everybody, you know, there was the physicians, the nurses, techs, like everybody just had like their role and like knew exactly what to do, and it was just like a well-oiled machine, like at least to me. And now looking back, like I realize, like seeing a lot of the med students now, like med students don't always, like, you just don't, you're still learning, you don't know, you
Mhm.
don't have much experience, like you don't always know exactly what's going on. But I just remember thinking like, wow, like they really have it down, like they all know exactly what to do, everybody's staying calm under pressure. And that was like, I don't know, I just remember thinking like how cool it was that they like just were very calm in this like traumatic situation and just did their job, and everybody like, you know, knew what to do. um and after that, I did go through a period in med school where I was like, I want to be a trauma surgeon, and I just thought it was
Mm.
like, would be such a cool, like rewarding job. But then like there's a lot that goes into like picking your specialty, and like the lifestyle of it was not necessarily what I
Mm.
wanted. And then I ended up liking OB for like different reasons too. But yeah, that was one thing I just always remember, being on that rotation and like seeing some of the trauma cases and how like quickly and efficiently like people could work under pressure.
Yeah, that was mm, our experience when the girls were born. That's what I felt as well. Like you said, a well-oiled machine. I mean, we go in there. They were like blasting music.
Yeah.
The the girls were born to Million Dollar Baby was playing,
Yeah.
and
I
everyone was
remember Lauren saying that. That's so funny.
everyone seemed so relaxed except
Hmm.
for me and Lauren.
Hmm.
And they, there I think there was like four nurses in there, two doctors. Is I don't is that normal for
Yeah.
each birth to have
Yeah.
two?
Yeah, it really depends on where you work, because like I work at a like a small teaching hospital,
Mm.
but I work with the University of Wisconsin residents. They have like their main hospital that's much bigger, and then ours is like a smaller community hospital. But we work with the UW residents. And so, like, when I do a C-section, it'll be me and a resident, because you need two people like across the table from each other. And where I worked right after residency, I practiced in Michigan for a year while Jake, my husband, was finishing his residency. We didn't have residents, and it was like a very small, like hospital kind of in the middle of nowhere. And I would have a tech, like a surgical tech, assisting me. um,
Mm.
but then some places it will be like two doctors, and maybe they do that for all C-sections, or maybe for twins, because it can be sometimes a little more difficult of a C-section. So yeah, I don't know exactly how they normally do it, but that is common to have two doctors, and then usually a surgical tech and anesthesiologist and several nurses um, there for the delivery.
Yeah, I was very impressed. So you kind of painted that picture of standing there as a student. Like I could imagine,
Yeah,
but it
and as a student,
but
you're like, what the heck is going on? Like
yeah.
like trying to keep up and like figure out what they're doing. And um, then now I realize like, okay, I had no idea like so many things as a student that like you just don't know and like don't realize. And it's like just kind of crazy to look back and like think, like see how much you've learned just from like experience and time. It's crazy, more so than you could learn in just reading and hearing lectures and stuff like that.
Yeah.
Oh, sure. It's at, at what point then? So did you do you did a period where you shadowed an OBGYN for like a
Hmm.
4 to 8 weeks?
Hmm.
And did something happen during that time that made you decide like, okay, I'm gonna go this route?
Yeah. like I said, I after I had that, well, it was like I was with an anesthesiologist, and we did, saw a lot of like trauma surgery in that time with him. And then my next rotation after that was general surgery. So doing a lot of like appendectomies, removing appendix,
Yeah.
gallbladder surgeries. He did a lot of hernia surgeries, um, and things like that. And I was like, I really liked that rotation. I was like, I really like doing procedural stuff, even
Mhm.
though I wasn't, obviously doing it myself, but like kind of assisting and seeing. And I was like, I really like that aspect of doing some sort of procedure or surgery. So I was kind of thinking that route at that time. I wasn't really thinking OBGYN much, at least in that short like time period. And then my next rotation after surgery was OBGYN. And I I remember, I don't remember exactly when it clicked, but I think it was like the very first time I delivered a baby, and I was with the attending, and we didn't have a resident. So usually like if there's a resident, like the resident does a lot of it and the student is just kind of observing. But in this case, we didn't have any residents with us. And I had seen a couple births, like I had seen him do a few deliveries,
Mhm.
and was just kind of like, assistant, like kind of right there, but like not doing anything. And then one day he was like, okay, like you got this, and let me deliver the baby. And like
Wow.
it was just such a cool experience. And I remember like leaving that day like in the parking garage of the hospital, and I remember I called mom and told her that I delivered a like I like got to deliver a baby, and it was just so awesome and so cool. And just that feeling, like I just left with like a high that day. And
Yeah, I
I
bet.
just had this feeling like this is what I'm going to do. um and he also like we also do surgery, like c-sections and gynecologic surgery, and it's a lot of procedural stuff too. And then we're in the office, like it's just a lot of variety. And so I was like, this, it just fits everything. And it was just more so like a feeling that I got when I was there. And even though like I had kind of touched on like I liked the surgery side of things, but like the lifestyle of like a surgeon or a trauma surgeon is not always that great. Like you're working weird hours, and it's not, always like a great like lifestyle. And neither is OBGYN, but that's kind of how I knew too. I was like, well, this is what I want to do, and it doesn't really matter what the if I'm going to be in the hospital at 3 a.m. delivering babies, like this is what I want to do. um and I will say too, like that feeling too has not gotten old. Like every time I deliver a baby, it's like still such a good feeling.
I can imagine. We just recently had my daughter. She's 7 months old right
Oh,
now, and the OB we had was really really cool. It was a really cool experience. But I was just a wreck this time. I don't know why. I thought I was good, and but the nerves started getting to me, and then it took a while. My wife was in labor for a while, and then it happened really early in the morning. And as things started progressing, the OB, well, my wife's like jokingly, she gets to the stage, she starts pushing, and my wife is like, "Can, you should help." And I was like, "Help?" I was like, "No, like I have no idea what I'm doing. Please." And
Help.
yeah. But no, but she was like saying like, get in there and do some. And the
Yeah.
OB was like, he was like, yeah, he's like, throw some sterile gloves on right there. And I was like, you know, initially I was like, no, please, like, I do not want to do this. You cannot throw me into this right now. And he's like, no, you'll be fine, you'll be fine, I'll help you. And so I did the gloves, and like I was like actually helping. Like he was like,
Mhm.
push down, and I was like pushing down. I was like, I feel like I'm pushing down way too hard, like this, you know, doesn't feel right. He's like, no, you're good. And then he was like, now pull up. And like, so I was kind of in the process, and he definitely took over at the end. But like, even that little bit of like just seeing it happen and like supporting it, and like I could see how like doing that full on would be a crazy experience, because the amount of adrenaline going through me,
Yeah.
making sure I was
When
doing
you're
everything
on
right.
TV too.
Yeah,
Did
but
it, did you tell that lady, hey, this is my first time?
No. She knew I was a student, and also
Oh,
like I feel like at that point for a lot of patients, like you just want that baby out of you, that half the time they don't even care who's
well, right. Like Nick's story just now. It's like anyone get the gloves on. That's crazy. Yeah, for
yeah.
me, I I stayed well because for us, it was a C-section to get the twins. And I learned all this stuff just this past year, but I guess how that is considered a safer option, especially for the second baby, I guess is at least the hospital we went to. That's
Mhm.
how the doctors.
Yeah, there's so many factors that go into it with twins, and so that's what, like, you can't, kind of like going back to, like, you can't treat everybody with the same condition the same. Like, no
Mhm.
two moms with twins aren't necessarily the same. And so, like, there's a lot of factors that your doctor will, like, talk to you about to, like, recommend delivery route and, like, what might be the safest, and everything's about, like, risk and benefit, and kind of making that decision, like, with the patient. But um, yeah, there's like multiple reasons, and oftentimes, especially um, for a first time mom, like, there is quite a bit more risk with the second baby, especially.
Yeah. I'm trying to think what I had something. Oh yeah. While you're talking about that, like these, uh, and we'll jump back to the timeline, but with some of these shows, like we know there'll be some military shows or movies that are way more realistic, and some are just
Mhm.
kind of goofy. We were watching a Chicago Med not too long ago, and there was this scenario. I want to say it was triplets, but what happened was the lady thought she was just going to have two babies in in the episode that we were watching, and there was a third baby behind that wasn't showing up on any of the ultrasounds. Has that ever happened? Like, is there ever a surprise baby that I feel like with the technology these days,
Yeah,
you're never gonna
I've never seen Chicago Med, but now maybe I'll have to watch that episode to see what happened. Um, that doesn't happen. So I have had I have had a surprise twin, but it was
like at birth.
at birth, but it was a very different situation. It was
Oh,
a patient who had not had any care during her pregnancy at all, and
oh,
I think didn't know she was pregnant until much later.
oh wow.
And so she never presented for care or for ultrasounds or anything like that. Um, and the best time to diagnose, to see twins or, like, know what type of twins they are is earlier in the pregnancy. And then there were a few different factors in this patient's situation that um, when she came in to the hospital, she did get an ultrasound, um, but because she was so far along, like almost to, we never really knew exactly how many weeks she was because she never
Mhm.
had like any good dating earlier in her pregnancy, but she was, later in the third trimester. Um, that ultrasound is sometimes a little more difficult because the babies are larger. But for her to, like, she was a very obese patient, and so it made
Mm.
being able to see on the ultrasound a lot harder. And
Mm.
I know the ultrasound tech had thought like there could possibly be, so we had an idea that like there could possibly be two, but like we couldn't
That's
know
crazy.
for sure. And then she ended up having a C-section, and sure enough, there were two babies in there. So, things like that do
Wow.
happen occasionally, but for the most part, like especially in a patient who has gotten regular prenatal care, like
Mhm.
there's no surprise twin or triplet.
When I was that story is so interesting because when I was working as an EMT too, we had a lady come in and she was experiencing pain, and as they were going through the thing, they found out that she was actually in labor, and she
Hmm.
had no idea the whole time.
Yeah.
And so it's like
Oh.
she just went up and was about to have a baby, but
Hmm.
like from point A to point B, no knowledge of it, and it's like, all right, now having a baby tonight
Hmm.
instead of like a normal emergency room
Yeah.
trip.
Had that multiple times.
That's crazy. That just seems so
It
crazy.
is
How
crazy.
is that, like you had mentioned that woman in particular, was obese, like,
That was the same thing on the at the when I was an EMT.
is that why that people or is there
Um,
sometimes women just don't show any signs, like, even if they're, like, fit and healthy?
yeah, I
'Cause I
don't
feel like
know. I mean, definitely for a patient who's maybe a little bit larger, you don't know, like other people don't notice on them, and like they might not notice like
yeah.
um the belly. So that is oftentimes the case. Sometimes, I've had a few of those cases where the patient has like a psychiatric illness or like a developmental delay or something like that, where like
Mm.
cognitively they just didn't understand that they were pregnant, or like, and so there's been some like, weird situations like that. But then I have had one patient that I was kind of confused about because she was like a thin, like healthy girl, um, like not even a young like teenage. She was like later in her 20s, maybe 30, and um, like overall was like a very normal person and was like
Mm.
engaged and like about to get married in a few months, and then she like came in and had a baby, and like
Wow.
nobody knew she was pregnant. And I think she had the baby at home, like she just went into labor and like had a baby at home and like didn't know why she was like in pain, and then came
Oh
into the
my
hospital
gosh.
after. So I never like saw her when she was pregnant to know like, how did nobody notice your belly? It was like a normal sized baby. So that one definitely confused me, how
Yeah.
she didn't know and nobody knew. But um yeah,
That's
maybe I mean, some people do hide their pregnancy and well, and like don't gain a ton of weight or like have a big belly, but it's not usually the norm.
it
Wow,
seems
that
to
seems insane.
Yeah,
physically
yeah,
impossible.
Yeah.
that's what I thought.
Yeah, that's crazy.
Just chilling at home and
Hmm.
you just have a baby. I could not imagine that scenario.
Yeah.
I know, and then you have nothing like, gotta Amazon or Target pick up all the all the baby stuff.
Yeah, you're just not prepared at all.
Yeah. I was thinking like they ordered pizza or something. Pizza guy knocks on the door and there's get out of here.
You just see we're having a baby.
Chaos. But going back to the schooling, so you got to deliver a baby as still a student, right? Like you hadn't got the white coat and everything. Were you able to kind of flex on the other students? Like, did anyone else?
No, because we all like everybody that I was with also rotated with the same doctor.
Mhm.
And he let everybody, like he would almost always let the students do a delivery.
Okay.
So Jake had rotated with him as well, and like Jake got to deliver a baby too.
Oh, I never knew
Oh, that's
that.
awesome.
Wow. Is you never forget your first baby.
Yeah.
Is that what they say? So then how much time was between like you delivering your first baby and then you, like, what do you call it, white coat ceremony? Like you're actually gain the title, you could put doctor on your mail
Yeah.
and
So the
stuff.
white coat ceremony is at the beginning of medical
Oh.
school. You get your white coat, but it's like med students have a short white coat, and then when you are a resident, then you can have a long white coat.
Hopefully it's not cold out. Why is it shorter?
So I think it's so people know, like, okay, that's the student, but it's like,
Yeah.
I don't know, it's not a very flattering coat. It doesn't look very good. So you get like the white coat ceremony beginning of medical school, and then once you're actually like have the title of doctor is when you graduate med school at the end of your 4th year. So then you're not like you can't practice on your own because you haven't completed residency, but you have that title because you have the doctorate degree.
Okay.
Where do you get another coat if something happens to the one you get?
Something happens to it.
I just never thought about that. You can't just like go on Amazon and buy a.
Yeah, you could.
Can you?
You could. There are.
Oh.
There's
Well,
people that do it.
I don't know about Amazon, but there are companies that make like scrubs, and you
Oh,
can
yeah,
order, like
okay.
coats from them and get it embroidered. But
Oh,
usually,
okay.
like whatever school or like if you're at a hospital, like by the time you're at a hospital, like they will provide you with the white coats. You could always order another one through them.
Okay, yeah, that makes more sense.
We got like 4 of them, I think. So
yeah, I feel like an idiot because you could get that stuff for like Halloween and
you could
stuff.
get it for
It's a pretty
yeah.
accessible.
And don't people there's been things, I was reading an article just the other day about someone like posing as like a heart surgeon, and then like how far could you get if you threw on a white coat and some gloves? Like,
I feel like you couldn't get far, but I recently heard about. I feel like somebody at the hospital was talking about that the other day. The heart surgeon. I'll have to look.
yeah, it was
I don't
just
know the
recent.
details, but it seems crazy because
Let me look it up. It might have been another it's probably another country.
maybe
most people in the hospitals know each other.
they know.
And
Yeah, because you'd have to go through like even if you were starting new, like you kind of have to go through like credentialing and like prove who you are, and like usually like
I found him.
sometimes like get fingerprinted, and so
right.
I don't know. I mean, yeah, you'd think if somebody just showed up, like the other people, like nurses and everybody else that you're working with would know, but I don't know.
This one says it was in the UK.
Oh.
What was his motive? It's not going to be successful.
Fake cardiologist arrested amid claims of 7 deaths. Real Dr. Camp. So he was posing as a
So
different
he like
doctor.
stole someone's identity. Yeah,
Uh,
I mean, I guess
But
we could
that's what
do,
I mean. Like, oh, that's gonna make us pay for this to read the rest of it. But
but you'd also
how do
think like when he started, people would be like, this guy doesn't know what he's doing. Like,
yeah, and who's paying
how
him?
did they get it, let him go that far?
yeah,
It said it's
that,
a con. Like, who let him on the payroll?
Right.
yeah. It says it's been going on for 5 years.
Wow.
That's
I don't
insane.
know.
But that's that's interesting. Um, what what is a typical day for you? Like now that you are practicing, what is the schedule like?
So for me, I'll give you like a typical week because my like day to day can be very different. But so usually, um, like Monday, Tuesday, Wednesday, I'm in the office. Usually like 8 o'clock to about 4 o'clock, seeing patients in the clinic, just OB patients, gynecologic patients, pre-ops, post-ops, that kind of thing. Um, and then on Fridays is my OR day. So I do surgeries on Fridays, either at the main hospital or we have an outpatient surgery center that we go to and do like more like minor surgeries and procedures there. And then a few days a month on any of those days, I might be on call. So, like, if I'm on call that week, like on a Tuesday, I won't be in the office that day. I'll be in the hospital. And when you're covering call in the hospital, at least for us, because our hospital is a little bit like we're busier. There are some OB jobs where you can like be on call from home if it's not
Mm,
super busy, but like usually there's like always something going on. So our call, like we're in house, and then you take care of whatever labor patients are there, any deliveries that happen, anybody who needs a C-section, and then any um, gynecologic emergencies like anybody who like has an ectopic pregnancy or like has like an ovarian mass or like ovarian torsion is another gynecologic emergency that sometimes we'll do that will need surgery emergently when we're on call or anybody that comes through the ER with something that's like a OB or gyn related thing. So those like call days, you're covering those things. Um, and I feel like I'm very lucky at the job that I'm at now, and why it ends up working really well with like having the two little kids and
hmm
with Jake also being a physician and like sometimes a weird schedule, but we have nocturnists who are like OB hospitalists, so they only are in the hospital and on call, that do all of our nights. So like we'll sign out to them
mm,
at 10 p.m. and they'll cover the hospital 10 p.m. till 7 a.m. And they are only, so they're not doing like scheduled surgeries, they're not seeing patients in the office. Their job is only in the hospital. And they'll cover like 7 nights on and then be off for 7 nights. And so there's two of them that flip flop. So then, like, even when I'm on call, the latest I'm at the hospital is, 10 or a little bit after to wrap stuff up. And then we'll be like on backup for them. So if they need to call, like sometimes, since you're the only, at least at our hospital, we're the only OB in house, like if there's multiple things going on or you need extra hands, like you'll have a backup person. So like we'll be backup overnight, but not actually in house.
Has that happened where you had to like how far do you live from the hospital?
I
And
I'm about 15 minutes,
Oh, that's not
so
bad.
it's not bad.
so get a call. It could be like 2 in the morning, and you might do you sleep in your white coat
No,
or
I'll have like on nights that I am backup, which is only like a handful of nights a month. It's not,
Mhm.
like it's every night. Um I'll just have like my scrubs set out on my dresser, and so that if I and it really has only I think I've only in the year and a half that I've been at this job, or yeah, almost 2 years, but probably a year and a half. Um I think I've gotten called in on backup like 3 times, so it doesn't happen very often um, for us. And so then I'll just like throw on my scrubs and run in. But we don't typically wear white coats in the hospital. I guess some people do, but I don't, and I don't think most of my partners do, just because a lot of what we do is messy. Like you're doing
yeah.
deliveries, and you're like just like your coat is going to get blood on it and get dirty, and then like it's much easier to just change your scrubs. So I don't really ever wear a white coat. Even in
Yeah,
the
but
clinic, I just wear scrubs.
yeah, both the OBs for both of my kids just wore scrubs as well.
Hmm.
But yeah, that does make a lot of sense. Do we have time for a quick bathroom break?
Hmm.
I
Yeah.
hate to do it, but
No, yeah.
I'll be
Take a
super
5-minute
fast.
break. I'm gonna get some more water.
Okay.
So Lauren was telling me about this where she took a class in college that was it was like a philosophy course, but it was also like they're covering like morals and ethics.
Hmm.
And the situation was there, and I'll try to pull up the article here in a second or to get more information, but there was conjoined twins that were going to be born, and something with the early tests, um the doctors had deemed that like the way in which they were conjoined, like if they were born that way, like neither baby was going to survive. So the doctors recommended they did some kind of surgery to separate them, and but by doing that, like only one baby would survive. Um and the I believe the parents um were had more of like strong religious beliefs that there shouldn't, like, it's God's will, there shouldn't be any kind of interference. And then the doctor's thoughts were, well, we're in the business of like saving lives, and if we can at least save one baby, like we should. So what is taught to you guys about that kind of stuff? Like, who gets to make the call? The parents,
Hmm.
or like the mother that's giving birth, or it was the doctor gonna do everything they can regardless of what the mother says? Like, what?
um well, yeah, that's a really tough situation. I've never seen conjoined twins ever.
Mhm.
So I haven't had that exact situation, but um in in so what we're taught, and like legally too, the patient makes all of the decisions, and has to consent to anything. Like if you're going to do any kind of procedure or anything, you have to get consent. So even if those can be tough situations for us when like you what you recommend and what like we think and know is like the better option for whatever situation it is, not this specific one.
Mhm.
um and the patient does not consent to what you are recommending, that can be really really tough. um but yeah, in that situation it would be the mom, the patient's decision, whatever you choose.
Yeah, that
uh, uh,
seems really tough to navigate. Obviously you have to, it's the way you have to do it, but like you make a recommendation that could save someone's life, and they're just like, no, I don't agree with that. You
Mm-hmm.
know, that what else can you do at that point?
Mm-hmm.
But yeah, that's tough.
yeah, it says, and I'm going to try to pull this up on the screen. Oh, here we go. I'll transfer it to the Mac. Perfect. Let me share it. Okay, so it was 21 years ago, but it wasn't even in America. So that would, different countries have different rules, but
Mm-hmm.
yeah, it says if they were not separated, they would both almost certainly die within 6 months. The girl's parents were devout Roman Catholics and believed that nature should be allowed to take its course, stating, "We have faith in God, and we are quite happy for God's will to decide what happens."
Mm-hmm.
And yeah, that would be. Have you heard of anything like that happening in the United States, or was there any like case studies that you did at school?
I can't think of
Look at
anything. I mean, I'm sure that there have been. I can't think of anything off the top of my head. I do remember a case that I had in residency that was not to the same extent, but it was also like a very difficult um like choice that the parents had to make with twins, and like they were very preterm, and one of the babies was um not growing normally, was much smaller than the other twin. So it was like baby A was very small, and was having some abnormal blood flow through the umbilical cord, where like in that situation, if it was just one baby, um we would recommend delivery, even like extremely preterm, because there's a high chance of stillbirth once we see those like changes that we were seeing in baby A. But then baby B was totally fine, was growing normally, didn't have any, you know, thing abnormal with the placenta or the fluid or anything. Um, and so that was the decision, was like, should we deliver both babies now, knowing like there's a high chance of stillbirth for A if we don't deliver, but then both babies are going to be extremely preterm and could have
Mhm.
long-term complications from that. Um, so basically, like if you deliver to try to save A, then you are risking like long-term medical complications, even like developmental disability, cognitive delays, all of that for like an extremely preterm baby for B, when like if you continue the pregnancy to get B further along, then you're risking a stillbirth for A.
Mhm.
So that was like,
wow.
there's no right answer. So
Yeah.
that was a really tough situation. That's the only thing that kind of comes to mind. I can't think of any scenario that I've had where it was like, you know, saving one baby or losing both. Like in that article, that seems more like a, well, I mean, I think a lot of people's gut would be like, well, if this baby is not going to survive anyway, then I'm going to do what I can to save the other baby.
Yeah.
Um, but like in the situation that we had in residency, it was like there was no good, and I mean, you could argue either way, and it's kind of like a very tough decision that the parents had to make. Um,
What did the parents
they ended
decide?
they ended up waiting like another, I forget how long. They ended up waiting a little bit longer. And um I think baby A did end up passing, but after birth, like they did wait several, like a week or several weeks longer to try to get more time for baby B.
Mm,
Um, and then ended up delivering, I think because the other baby was looking worse. And then that baby ended up passing regardless.
mm.
So
That's awful.
Oh,
yeah.
well.
But I think from what I remember, the other baby did really, really well. But yeah, there's situations like that where there's no good choice.
Yeah.
Right.
And so you can counsel them on the risks of either option, but like we also don't know that the outcome, like that's all that we're counseling on is like there's a risk of this and a risk of this, but like you don't know what the outcome is going to be. If we knew, it would make the decision much easier.
Yeah, there's no guarantees.
Hmm.
Yeah, I felt that even I mean, we thought we had some really good doctors, and we appreciated like their honesty with, we were very blessed. There was no concerns throughout the entire pregnancy, but just the decision to do um a C-section or not, like they you could tell like the doctors didn't want to say like this is what you should do.
Hmm.
They kind of just gave us the facts, and then you know uh, with those facts it it made the decision like pretty easy. But yeah, I feel like you don't want to, because you never know what's going to happen. You don't want to tell anyone what to do, and then yeah. Um,
Yeah. And different people may, like, you could have the same scenario and counsel two different people the same exact way, and they'll make two different choices. It's just, different people will make a different decision for whatever reason, or they just, have a feeling about which way is the better option for them.
what
Mm.
are is there anything that comes to mind that gets frustrating if where people try to go like against the grain
Mhm.
on, I can't really think, since I'm not even in that world obviously, but like but there's always people that are just like, I'm not going to listen to what the doctor says, and
Mhm.
even though they're going to you for help,
Yeah.
is is
That
there anything?
that is a big frustration and something that we run into literally every week, if not
Oh,
every
really?
day.
Wow.
And I think I we see this across the board with every kind of like someone who's an expert in whatever. Like, I think there's a big problem right now in general of like people don't trust or don't believe experts, whether that's, different scientists in different things, or like, I, you know, like climate change, for example, like people are not believing the experts who are dedicated their life to studying this. And, so
You know,
it's the same thing with medicine. And we're also seeing it with like vaccines, with the measles outbreak right now, and people are not trusting their pediatricians and not trusting the people who have dedicated their lives to studying um, um, these viral illnesses and things and the vaccine, the how vaccines work and everything like that. So we definitely see that with obstetrics quite a bit. And I see it on social media as well, like on my own like Instagram and things like that, like especially since having kids, like your algorithm kind of changes to like
Yeah.
all like when I go on Instagram, it's like all kid related stuff and pregnancy and babies and all of
Yeah.
that. And there's a big trend on like avoiding induction, for example, and that like induction is very dangerous, and don't let your doctor push you into an induction or push you into a C-section, or just kind of let your body go into labor naturally when it's ready. And like um there definitely are like risks and benefits to inductions, for example, but some patients need um, to be induced for like a medical reason, like high blood pressure or preeclampsia, where it can be dangerous, very dangerous to mom or to baby. And before modern medicine was um, a huge reason for why moms and babies died during pregnancy and delivery. So like for example, that this is just one example, but I've seen patients who have preeclampsia, and I tell them, I recommend delivery, whether in their particular instances like being induced or doing a C-section. But I, recommend delivery at this time because, you have a disease that puts you at high risk of having seizures, strokes, dying, stillbirth. Like all of these are much higher risk when you have preeclampsia than for someone who does not, and is having a completely normal, healthy pregnancy. Um, and people have refused that and just choose not to take your recommendation. um, and then I've unfortunately seen some bad outcomes even in patients who do the recommended treatment and care, can still have a poor outcome. But then in patients who um, did not go with the recommended care, having a poor outcome. Um, but most of the time, everything is fine.
Mhm.
And that's what can be frustrating, because then people, I've seen people post on social
Oh,
media,
sure.
but like, well, my doctor said if I didn't do this, my baby was going to die or I was going to die. And like, I didn't do what they said, and look, I'm fine. Like my baby's
Yeah.
perfectly healthy. I'm fine. Um,
Yeah.
but I think it's like trying to get people to understand, like, yes, most of the time things are going to be fine still, and the odds are in your favor. But that's not like, this outcome is not something that you want to gamble with.
Right.
And kind
Like
of,
Right.
you could
telling
drink and drive.
exactly
You
like
could
you
drive
can.
20 times and be like, I don't know what the big deal is.
Right.
And then,
Most of the time, things are probably going to be fine.
yeah.
But
Yeah. And
if you get into a car and you've been drinking, like you have a much higher chance of killing somebody or killing yourself. And that's the thing that is sometimes, I think, hard to grasp, like why sometimes patients are not understanding that. Like when you're telling them, like, I'm not saying this is going to happen to you if you don't do this. I'm just saying it's a higher risk that it could happen. And so yeah, we have those conversations a lot. And I feel like obstetrics and probably pediatrics too are very, very um it's very, very common for patients to do their own, say, they do their own research and
Mhm.
want to do maybe what they think is like a more natural approach or something like that, which I'm all for. But there's certain times where it's dangerous to do those things, and it can be really frustrating when people don't, they come to you for um, your expertise, but then don't take the recommendations.
Yeah, I mean, I know for myself, I want the least amount of risk possible in that scenario. Like if somebody that's been doing that has done this, has delivered babies, and they say, "Yeah, you should probably do this." Okay. Like, for me,
Hmm.
Yeah.
that's like you said, it's definitely not something you want to gamble with.
Hmm.
Yeah. How do you handle those tougher situations? As I take it, you have delivered babies that are stillborn, and um, what is your role in that? Like, are you do you give any kind of counsel to people, or is the doctor's role to perform the procedure and then leave the room, good or bad? Like, because I know with the twins, it was like obviously everything was perfectly fine, and the doctors kind of gave us a thumbs up and walked right out.
Hmm.
Yeah.
Like their job was done. Um, I don't know if you're okay with like talking through any of that. Like,
Yeah. Um, it kind of depends on where you work. Like, there's so many different practice models, and um, like for us, for example, like we're doing all the deliveries and like taking care of the patients when we're on call. And so they're
mhm,
not necessarily like always the patients that I personally know or like see in the office. If it's a scheduled like C-section, then I will schedule my own patients when I can do, and I will plan to be there for that. But like for like a delivery or like stillbirth, for example, if somebody comes in and has a stillborn baby, um, I may have never met this person before, and oftentimes have, most of the time have never met this person before and don't have a relationship with them like I would if it was like my personal patient from the office. So,
yeah,
you know, it can be kind of different, and different people need different things, and often I will try to like feel out or directly ask them like how much they want. Like, some people will just want to be alone, like with their husband or family member or whoever is there with them,
yeah,
and like not really want you there. And then some people do want like more, like having either me or the nurse or like combination of people more so in the room. So it can be different for different people. um but I always try to talk through things before the baby is actually born. What the patient or the couple or whoever it is wants, because some people will want to see their baby right away and hold the baby right away, and then
mhm,
some people don't. Some people don't want to, they either don't want to see the baby at all, or need some time. And so like we kind of talk through those decisions and like what they want afterward, beforehand, if there's time. um and so if it's somebody who I don't have a prior like patient relationship with, I'll check on them periodically afterward. But Yeah, I don't know if that's answering your question, but if it's somebody who I know from the office, or like say like it's my patient, but like my partner delivered their baby because they were on call, then I will check in with them pretty frequently after, like either on the phone or like virtual visits, just kind of like, talking through things, seeing what they need. And then we have different resources that we'll give to them, for, either counseling, therapy, support groups, like grief support and stuff like that. Um, so usually the like after like longer term follow up with them is done by like their primary OB, which is not necessarily like the person who may have delivered them.
Yeah, it makes sense. Because how it was for us, it was two doctors. We had never
Yeah.
we had seen them around. Um, the way it was where we went. There's like um the list, and I think you kind of touched on that, Nick, when you were at EMT. Like you see all the doctors' names, and it says
Mm-hmm.
like MD and DO and everything. So we knew who they were, but they weren't like the doctors that Lauren had seen regularly.
Hmm.
But that's how how do doctors like yourself and others, like, that's got to be a struggle. And you yeah, you've told me this before about, everybody says like, oh, you work with babies, like it must be just awesome every day. But then there's this other part of the job that, when things go wrong, and just there's probably been some terrible nights, or
Hmm.
during the day as well. Just um are you kind of offered like a day off to like at least to recoup, or is it can you have a situation like that and then you're supposed to just kind of slap a smile back on and go on to the next patient it's
Yeah.
still needs you?
Um, yeah, unfortunately not that you don't get used to it, you never get used to it, but like you get used to, um like for us in obstetrics, like you are taking care of patients like on the best day of their life, and then other people on the absolute worst day of their life,
Yeah.
and like the worst thing that like a parent can imagine. So you do sometimes have to leave those rooms with a horrible outcome and like so much grief, and then go down the hall and be happy for like these people who are having a healthy baby, and be excited for them and deliver their healthy baby. um so that is really really hard, and it never gets easy, but it does kind of get easier, unfortunately, because it is a somewhat frequent, not, all the time, but it does
Yeah.
happen often, um, where you have to kind of like switch, like, um, kind of your mood for the patient, and then, um, in medicine in general, like with across all specialties, like when we lose a patient or have really difficult situation, like we call it like second victim syndrome. Like it's not it's not about you, like the bad thing didn't happen to you, but like you had to deal with it, or like dealing
Yeah.
with a poor outcome, like just going over that in your head so many times, like could I have done something differently, should I have done something different. Um and there's so many different aspects of that, like, you know stillbirths are unfortunate, and miscarriages, like miscarriages in
Yeah.
general, are unfortunately very very common. um Maternal deaths, losing a mom, is much more rare, luckily very very rare, but it does happen, and those tend to stick with you a lot, as well. And then, even when in general, the outcome is good. Like birth can be traumatic, and can have situations where like like this person would have died if we didn't have modern medicine and if they weren't in a hospital. And so like though those situations can like really, I don't know, throw you off for a little while too, like for the rest of the day or shift, or even like for several days, like dealing
Yeah.
with a really tough scenario where like you are saving somebody's life, and um even you do, and everything goes well, and like, or you save a baby's life, it can be still like very just stressful and sometimes traumatic too.
Uh, so I got a question, and feel free not to answer it, but when I was an EMT, something that happened to me for a good bit afterwards, is, I'd see a lot of these things happening and a lot of the bad things happening. And I kind of like internally for a while would like have, I can't think of the term for it, but like something would happen and I'd know the symptoms and I'd seen somebody like pass away from it, or somebody change their life. And I would think that from seeing all these things happen, maybe that's what was happening to me. Um, and as an OB and a parent, is it different to like when you're going to have a kid, since you've seen all these different scenarios? Is it tough to, you know, as like a normal, like my wife, who's not an OB at all, like she has no idea, anything that goes into it, right? So I don't know, was it different because you've worked around it so long, having kids? Was anything like that? Because I know for me, like I said, it could be something simple that somebody came into the ER and thought they were fine and they had this one symptom. And I know, like, I would internally, and it's gone now, but for a while, I would think that there might be something going on with me because I just saw this happen to somebody.
Hmm. That's a good
Yeah,
question.
that's a good question. And I definitely like some of my colleagues I know have gone through that a lot more, like in pregnancies. Um, for some reason, I was pretty calm in both
Yeah,
my pregnancies. Like I kind of, it was always in the back of my mind, like things that could go wrong. And I would like think like when I got to certain like weeks gestation, like, okay, I hit this many weeks. Like I know even if my baby's born now, like they're gonna do okay. Like now they're at the point where they could survive outside the womb
right,
if they needed to. And
Mm.
then, okay, now like the risk of this goes down at this point. So I kind of like marked it by like some
right,
of those milestones. Like, okay, now they're this many weeks, like the chances of this happening because of prematurity are so much lower. And I'd like feel, relieved at those marks. Um, but I don't know, I don't remember being like super anxious in my pregnancies. I did get very anxious with my second delivery, which was a scheduled C-section. And I don't really know why that was different. I think like with my first, I had a C-section, but it was like unplanned, and I didn't have a lot of time to like think about everything that was happening. But
right,
with like my second, like I knew the C-section was coming, and
Mm.
like I think that was a lot for me. But yeah, I know that other people that I work with have had that much worse, like what you're describing, like thinking like, is this happening? Is this,
yeah,
like personally, I don't know, for whatever reason, I I didn't really have that with pregnancy. At least I do with like now that the kids are here, I get anxious about different things with them, but for the most part, I can kind of separate it a little bit. And I think
Yeah.
too, like I try to think of it more logically, like, okay, there are like awful things that happen, but like those things are very rare. So like the chances of that happening to me are pretty small. And so I try to just block it out of my mind as like happening to me or my kids.
Right. Yeah.
Yeah, what is that experience like for you? Like, is it's just like one of your friends basically that's doing the delivery?
Yeah.
Um,
Um,
or would you rather have someone you don't know, or what? How did?
um, no, so with Charlie, my first baby, I delivered him right at the end of residency. So it was like a week before graduation. So I had an attending who I had seen like for my prenatal care and stuff. But then when I was in the hospital, my really close like best friends in residency were there with me through the whole, like I was in labor with him and then ended up needing a C-section, but they were there like helping take care of me the whole time. And then when I ended up, like when we made the decision that I needed a C-section, they scrubbed and delivered him and did the C-section, and the attending was there like on the side. But by that time, like their fourth year residents, they know how to, we start doing C-sections even our first year, intern year. So like they could do a C-section in their sleep, and delivered him. Um, and I think it made me feel more comfortable, like knowing like, okay, I know that they are really good at their job. Like I trust them. Like I know they're gonna take good care of me. And then with Lewis, he was born just not even, he's almost 6 months old. He's like five and a half months. Um, I was a little bit newer here. Like I hadn't quite been, um, when he was born, I had been here about a year. So when I was pregnant with him, I had only been here at this job in Madison a few months. Um, but I had already like formed a really good relationship with one of my partners. We share an office. Um, and so, and I had like worked with her a lot. We had operated together, and like I really like now we have become good friends. Um, but yeah, I had asked her if she would be comfortable being my doctor, because I really liked her and trusted her, and then she took care of me and then ended up delivering Lewis.
Hmm.
So I don't know. I think for us, we're like used to taking care of each other, um, because I think that's kind of more unique to OB maybe than to other specialties, because like so many people have babies, so like you take care of
Yeah.
nurses that you work with and techs and your like fellow physicians, because like most people, like that's the most common thing that people seek medical care for is pregnancy. So we're like used to taking care of each other. And like for me, I just in both scenarios like just felt very comfortable knowing like, okay, I know these people and I know that they're good at their job and I know they're gonna take good care of me. Like even though I was like really anxious with my second C-section for like whatever reason, I knew like I was in good hands, and like I knew the nurses really well, and I think it helped in that situation.
We
Yeah.
got a Patreon question too. I don't know if you want to pop into that real quick.
Yeah. Do you want?
Let me pull it up. Let me see.
I got it.
Oh, you got it?
Yeah. So I told you how we have some good people trying to keep the show alive, and they do like small donations each month, and then we give them a chance to ask a question. And this one we want to read off, coming in from Michael. He says, "Hey Paige, how many times was Dave dropped when he was a baby? Also, what is your favorite part about your work?"
Um, I don't know how many times. I'm sure maybe I dropped you a few times when you were a baby. Seeing how it's funny now because we're about like David and I are about the same age gap as my two boys. And like seeing
Oh yeah.
how, but I don't know, I think I was maybe not not quite as rough as Charlie is. But seeing how he is with Louis, I'm like, oh my God, like
Yeah.
I have to be like with like right on him all the time, or he will try to pick him up. He has like drug him across the floor when I've turned around for 3 seconds, and it's wild. So I don't know if I was anything like Charlie, maybe I dropped you. Um, but my favorite part, I don't know, obviously delivering babies and like having a really like happy, good delivery is really, really great. Um, but I think like one of my favorite parts is like just getting to make a difference or like improve people's like from a gynecology standpoint. I feel like we have a lot of opportunity to um improve like people's quality of life. Like we take
Mhm.
care of girls and women from like I have some like very young like adolescent teenage patients all the way to like 90+ year olds, so like taking care of people like in menopause and like helping them through some of those symptoms, or like um I just had a patient this past week that I did a hysterectomy for, who had been just like with her periods just hemorrhaging, bleeding so much every
Mm.
single time she got a period, and like no medications were working, and she was like in and out of the ER several times, like needing blood transfusions because she was bleeding so much. And um,
Wow.
then to be able to like do her surgery and like stop her bleeding, and now she's never gonna bleed like that again. And she was just like so thankful because it just now has like completely changed her quality of life, that she like she wasn't
Yeah.
even able to leave the house when she was bleeding because she was like soaking through her clothes every time she tried to do anything. So situations like that where you're just like where people are, you just can see that their like quality of life and everything is improved by something that you can do for them.
Yeah. I
Oh, that's
mean, it goes
awesome.
full circle back to why you said you were interested in it in the first place.
Yeah.
You know, I feel there's and don't get me wrong, it's understandable that um the military gets put like on almost on a pedestal. Like if you were to go put your uniform on and like people are trying to buy your food, it's thank you for your service, all these things. A- and I feel I don't know how it was. I feel like not until really like COVID, that's when people really started like appreciating and thanking healthcare workers. Like, of course, if you go through the experience of having a baby or being in the room for that, you're like, oh my gosh, these doctors are heroes. But I feel like in the general public, it I don't know. What do you guys think about that? Like I felt
Um,
we had Chuck on the show, and he was talking about in Chicago when they would do a shift change during COVID, and everyone would be out on their balconies and just like applause, and it was like COVID, I think, really highlighted like what nurses and doctors, EMTs, like it, it. I know it's always been appreciated, but maybe just more so within the past 5 years or so. Um,
yeah. I don't know. I like personally don't have anything to compare it to because I was going through like when
yeah.
COVID hit, I was in my second year of residency. Um, so I really like as far as like myself practicing medicine before COVID, I don't really have much experience before COVID. Everything's been during or after, which for like our emergency and ICU and EMTs and like all of those people that were like on the front lines of COVID, like they deserve all of the appreciation that they got. And really, like, I talked about second victim syndrome, like so many of those healthcare workers have PTSD and everything
Mm,
from all that they saw during COVID. And one of my best friends, Sarah, is a um, ICU nurse, and her husband is a emergency room doctor. And just some of the stories that they have, like it's crazy the stuff that they went through during COVID, where like on the OBGYN side of things, we were kind of more isolated. We were not on the front lines of COVID, luckily for us. I mean, we did have like I had a mom die of COVID, and I did a emergency C-section in the ICU um, as she was, you know, dying, getting CPR. Had to deliver her baby to save her baby, and so like, we
mm,
had situations like that were like very traumatizing to us and to everybody involved. But we were, other than those kind of isolated scenarios, we're not on the front lines of COVID. Um, so as far as like more appreciation of healthcare workers, I think there has been, but on the
mm.
flip side, there's equally been, and
The
I think
skepticism you talked
skepticism
about
and
earlier.
trust, especially during COVID, and that has been, um, you know, very, very frustrating. I'm trying to think of a better word because frustrating doesn't even really begin to cover it. How, like, when you're seeing these awful things in the hospital and like people dying of this virus,
Hmm.
and then to like come out of the hospital into like the world and like hear people who like either don't believe COVID's real, don't believe in the vaccine, don't trust it, like think that more people are dying from the vaccine or more awful, bad outcomes and things are happening from the vaccine. It's like you're not seeing what we're seeing. And that's, I mean, very, very just hard to deal with when you're like just seeing people who are not
Hmm.
trusting or believing what you're saying or what you're doing.
Yeah, it's there's a lot of that with and what we don't know pre-internet,
Hmm.
like how things were. Like we kind of came of age with the internet, but I feel
Hmm.
like that probably had a big effect. I mean, same with the military. Like there's a lot of war experts out there that have never set foot in the Middle East, and
Hmm.
even those of us that have been there, like, don't pretend to know every like and it's got to be the same with medicine. Like, things are always changing. Like,
Hmm.
you're everyone at the end of the day, everyone's just trying their best, and
Right.
they're gonna do the things that um have been proven to be the
And
most
things
effective. And
can change as we like get more information. Things
yeah,
change. Like we don't treat certain diseases the same way we did 50 years ago because we have new and better information as like more research is done. And I think that's where a lot of the distrust came from in COVID was like things were changing so rapidly because people like initially like didn't doctors didn't know what to do. And then like researchers are finding more info, so like sometimes the recommendations would change as far as like um you know masking or isolating or like so then when like the CDC or anybody was coming out and saying something different, like well now we recommend this because we like know more. Now people are like, well wait, they said this before, so like obviously somebody's lying or they're wrong because they're contradicting themselves.
yeah,
It's like no, that was just like what we knew. That was the best thing that we knew with the information we had at the time. Now we have more information, so like can say something different. So that
yeah,
like people do think that birth is over medicalized, and to an extent I can see that, and I think that there have been obstetricians in the past that um maybe do push for more interventions or more C-section. Like I'm not pretending that that has never happened, um,
sure, yeah,
and that there hasn't been like a lot of paternalism in the past of doctors telling you like this is what you have to do or this is what you should do. So I think there is sometimes um, there is a reason for distrust in medical professionals. Like there are examples of reasons um, in in even more modern time too. Um, so, but I mean, for the most part, at least in my experience and like the people that I work with, and um, I have worked with people who are maybe not the best doctors or that I wouldn't necessarily trust them. But for the most part, like we want the best for our patients and we do care and do want to give people choices, just want people to make safe choices.
yeah. It's well said. What's your what's your record? How many babies have you delivered in one shift?
In one shift, that in residency, I think the most I delivered in a 24-hour period was 14.
What?
Whoa! I was not thinking double digits was going to come out.
I I trained at a very, very busy hospital. We had a lot
14 babies?
of
You said that was a 24-hour
a
period?
24-hour shift.
That's insane.
Yeah, that's crazy.
And that day, like more were born, and I missed them. Like as the intern, you were just like running around catching babies, like just doing deliveries nonstop sometimes. Um,
That's insane.
the hospital that I trained at in Michigan, which you wouldn't necessarily think, like just being in not a huge city in Michigan, but it was the seventh busiest labor and delivery unit in the country. Um,
And that was Grand Rapids,
mhm,
right?
yeah,
For just people. we'll put some details if you ever send me that bio.
Oh yeah, I'll have
we'll,
to do the bio.
we'll put, because I always, we get so caught up in this, it's like a phone call sometimes, but
Mhm.
there's people listening that don't know where you've worked.
Yeah.
So,
Yeah,
you
so
know,
that was in Grand Rapids, Michigan. And yeah, so very, very busy labor and delivery unit. So a lot of babies there.
that's crazy. Do you do like a catchphrase or something? Like, somebody order a baby?
No, I don't have a catchphrase,
You give them the
but
finger guns and walk out. I can't even process that. 14
Yeah,
babies.
I was not expecting that number.
And then you get home. Hey, what'd you do at work today?
After seeing one baby delivered, I'm ready to collapse. You know?
Yeah, that's wild. Do you have any uh like, I guess I would say role models or mentors? Like, is there any doctors that you want to highlight right now where you like, I'm trying to think of the word for it, like that have taught you the most, that you've watched and been like, you want to emulate them? Um, who's like a badass doctor that?
um, there were a lot in residency. We had, because it was such a busy hospital, we had a really big program. So we had like over 50 attendings that we worked with. And
Wow.
um, I feel like you take different things from different people. And so like even now, like I'll be doing some, some procedure or certain thing, and I'll be like, oh, this is what, Dr. So and so did. Like, there's more than one way to do different things. And so like you take different aspects from different people that you've trained from.
Mhm.
And yeah, so quite a few people that I think about pretty regularly of like, oh, how they would do this, or they taught me how to do this, and like thinking back, like, okay, what was that they did, or what was that they said. And um also like I think a lot of the people that I really looked up to or like wanted to be more like, or kind of like would seek more advice from, just like in general, not just in medicine but like in general life, or like female physicians who were like also um especially now, like also moms, and like seeing how they juggled like being a doctor and being a good mom, and like kind of doing it all. Where sometimes like it can be hard to balance, and like just kind of seeing like, okay, how did they navigate these kind of situations, or like still like um my partners and like past people that I've worked with now that I'll talk to about those things. um and I think like another similarity that I kind of thought of between medicine and like the military is like the the your experience is so, I don't know if unique is the right word, but it is like unique where like nobody else knows exactly what you've been through, as far as like
Mhm.
in our training, and then like in our job. Like the only, and this could be said for like many different fields, but
Sure.
like the
Yeah.
only people who know are like the people who have done it alongside of you. And so my like best friends from residency I talk to e- every week still. Like we are always talking and like always in touch about like different and I can like ask them like about different like clinical situations, or like just to complain about work and like complain about how, you know, much certain things suck and how tired we are sometimes. And so like that, um I don't know what I would do like without them sometimes, like because they're really like truly the only people who understand, like
Yeah.
even
Like,
Jake, like being a doctor as well, he's in like a totally different specialty, and like he knows like what I do, but he doesn't really, like he's never experienced some of those things, and just like I have never experienced some of the things that he has.
right.
So having those people that like have been with you from the beginning to still be able to go through it, all of that with.
Does Does Jake ever catch him like telling people at a party that he delivered a baby once, and you're like, "Well, I did fucking 14 one day."
No, I think I, no,
No, he would never be the type to be.
he's not the type.
I'm just joking. Yeah, because I had never. I mean, I've known him a while now, and I never knew that he.
Yeah.
But it makes sense that you get exposed to so many different
Hmm.
things in school. Um, yeah, it's wild though. One One thing, I think this will be kind of my last question, and then we'll see. I don't know what else Nick has, um, or if there's anything more you want to touch on afterwards. But we, we we're always talking now about like the AI stuff and robots, and
Hmm.
yeah, there's a whole scene in Star Wars when Luke and Leia are born, and it's a robot that's doing the whole procedure, and Master Yoda's behind the glass. Like, there's no humans in there. Do you, is that ever gonna be a possibility? Like, with the little bit of knowledge that I have, or the little bit of exposure I have to it, um, I feel like this is one of the jobs that like AI and robots would not be able to take. Like, I feel there needs to be a human intervention. um but is there, what are your thoughts on that? Is there anything coming down the pipeline where they're gonna where AI could assist you in your job,
I don't
or
know. I There's a lot of talk about this in medicine right now, but you should have Jake on the podcast to talk about AI, because if there's one area of medicine that like AI could take over first, it's radiology. And there's
mm,
all, and he could tell you more about this, but he's like told me a little bit about
yeah,
how
we'll have him
for
on.
like mammograms, for example, like the computer, the AI has like been, I think he said they have done like some studies. I don't know how official or anything, but
Yeah,
um that like
heard it.
AI can detect breast cancers better and sooner than like a human.
Hmm.
Um, so like for
I
things
did
like,
see something. Even just like scrolling on Instagram, I think I saw,
mhm,
and but anything there. I mean, we just had April Fool's Day recently, and like every post for like a week was fake. So like I'm not one of those people that's like, oh well, I saw it on Instagram. Like, but I actually did see. I did see a post that was talking about something like that. About it
yeah,
was showing like the accuracy percentages of AI being able to read these things.
hmm, yeah. So I think for like imaging, like CT scans and MRIs and mammograms, I do see that
Wow.
being something that, it may be in the near future. And Jake definitely knows a lot more about that, because they're talking a lot about that in radiology, which I don't, if they can detect, if AI can detect like certain cancers, for example, better, like that would be a good thing.
Yeah,
And
definitely.
I don't see that happening in other, like I don't see that happening in my job.
Yeah.
It's not as like, I don't know.
The oh, did it freeze up? Oh no, it's
No,
fixed
it's
now.
good, yeah. Yeah, I don't either. I mean, I just don't see how that would even work because it's
Yeah,
not like
I
it's
just,
reading an image. It's just
yeah.
anything can happen.
And I don't know enough about AI to really know like what what it can do.
I
So
just know
yeah,
it
I
doing
don't
my
see it
homework,
happening,
but
but
but yeah, the like you were saying, Nick, or just even like what's it called, bedside manner?
hmm
Like, I don't. There probably is women that might be more comfortable with a robot than a person, but like, I can't imagine. You know, I feel just for that piece, like maybe there'd be something to, like a robot assistant. I don't know, but
yeah,
I,
I
I
think
don't see I don't see your field
yeah, I could see like
implementing
AI
that,
being maybe helpful in
like
like,
being able to read the tests
yeah, like doing
quickly.
certain things, but I just don't see there like not being a need for humans like in the
All right.
hospital.
Yeah.
More like a more upgraded vitals reading thing or something. You know,
And
maybe.
Nick, your mic's starting to go a little quiet
Oh,
too. Tell Humberto to tweak it.
am I good now?
Yeah, that's a lot
Yeah.
better.
Let's back it up from it.
No, you're good. I just for those like last 10 seconds or so.
I'll send him an email.
Yeah. We sent him home for the night. But yeah, I don't know. Did you have any more questions you wanted to hit up, Nick?
No, I appreciate you answering the questions I did have. It was
Yeah.
very informative and a lot of things I didn't know about that go into the job.
Yeah.
Yeah, it's we try to really think about these things for each guest before on the outside looking in, our audio's all messed up and Nick's making pasta upstairs. like
Oh yeah,
we
how did the pasta go? It was on the stove for a long time, it seemed.
Still cooking.
Oh.
That's the way to do it. It's the Italian way. You just
Oh,
let it
homemade.
slow cook. Yeah.
Yeah, it's
It
probably
might
good
be
as hell.
burning now.
That's gonna be a good midnight snack.
Because
Yeah.
But
I made spaghetti for Charlie, but just from a box and a jar of sauce.
yeah.
Still
What do you,
good like that too.
oh yeah, I would crush some right now.
Mhm.
Um, what do you think, Paige? Is there anything that we haven't talked about that you think the world needs to know?
Um, no, I think we hit on a lot of good topics. I will say if you're looking for a good medical show, um,
Oh,
The Pit it's running right now. I think the season finale is on next week.
the pit?
But The Pit is on it's on HBO Max.
I know that as a map from Halo 3, but I haven't heard of the show.
um but it's like the main actor, yeah, Noah Wiley, he was on ER when he was
Okay.
younger. And now he has made this show. Um
Dr. Michael?
and then Melissa King, Taylor
Oh,
Dearden,
Taylor Dearden.
she's Bryan Cranston's daughter
Oh, really?
from Breaking Bad.
Oh yeah.
But it's a
Like,
really good show, and it's like probably the most medically accurate show I've ever seen.
okay.
And a lot of my friends that are like ER
Yeah, Lauren's gonna want to watch this for sure.
doctors and nurses are like, it is totally spot on. And it hits on like a ton of like hot button topics.
97% Rotten
Yeah.
Tomatoes.
It hits on like all the like hot topics in medicine and like for healthcare workers and kind of what people go through. So it is really good. There is a scene, a birth scene, like a OB case that they have, and that
Hmm.
is not good. That is not, it's not realistic at all. Whoever they
Oh,
had as like their expert like consultant for OB,
hmm.
they needed somebody new. I could have done it.
Well, hey, um, as our audience is growing by the day,
Yeah, the directors of the show might catch wind.
Right. Yeah, if
yeah,
they need
Get you in
somebody
the
for
next
the next
season. This could
season,
this could be your
I'll
big
do
break.
it. But other than that scene, it's really, really good show.
Well, that's interesting. I'm glad you told us that. So now, because I'm sure there's people that have watched it, or
Hmm.
now that we're gonna be going into it, I probably would have texted you or something after, but now I'll go into the scene knowing, like, all right, this is bullshit.
Yeah. But everything else is pretty good. Um, yeah, we have a HBO login if you need a login. If you don't have a,
Yeah, should I pull it up on the screen?
just give it out to everybody.
Yeah, no, that's cool. I'm still kind of scrolling. That'll be a good one to check out. Yeah, but yeah, I mean, I'm over here yawning now. It's almost midnight. Um, but that's what we got to do right now with uh, what is there? There'd be six kids between the three of us right now, and
Mm,
most of them are under two,
yeah.
or two and under. So um, we're pulling off the impossible here. Anyone that says they don't have time for a podcast, uh, this is how we've been having to record things, either like 5 a.m. on a Sunday morning or late at night on a Saturday. So I appreciate you staying up late with us and
Yeah,
taking the
it was
time.
fun. Thanks for having me on. I'll
Tell Jake to
definitely,
let you sleep in, and
yeah, well,
we'll
it's up
we'll
to
have him.
Charlie, really. He comes and
Yeah.
gets in my face. The other morning, Jake was gonna let me sleep in, and then Charlie came in the room,
Oh.
and he has a flashlight. It was like, and he shined a flashlight right in my eye. Like, yeah.
Oh, they say you'll miss it when it's
Yeah.
long and gone. So that's been me and Lauren's philosophy, is like, we're gonna be tired, and this is the only reason I would want to be tired,
Mhm.
or through these years. So, but yeah, we can't thank you enough for coming on. We can't do this show by ourselves. We're relying on some experts and some people with cool life experiences and stories to help us out. And then, like I said at the beginning, maybe I won't have to finish college, and we
Yeah.
could turn this into something.
Well, yeah, I'll let I know Jake would be happy to be a guest if you would want him to. Um,
Yeah,
definitely on the AI stuff, he knows a lot more than me, and he could have an
yeah,
interesting conversation about that, I think.
I think we would have a great discussion, even just about gaming. And I know he's a lot tuned into a lot of tech things,
Hmm.
or at least last time when I was talking to him about it, he was interested in some of those things from different podcasts. But yeah, I mean, I just mentioned gaming. Our first plan was to make we wanted to make a podcast of some type, and we started with a gaming podcast, but then we realized that we have newborns at home and we don't even play video games enough to be able to talk about them. And so we shifted to this, which is much more natural. But one last thing that people may not know is you completed Red Dead Redemption 2 um, with
Before I had Charlie.
before you were a mother. But has there been any gaming in your household since Charlie? Have you and Jake been playing anything?
No, we did purchase it's been over a year. Because it was when we were living in our last apartment. I remember we were playing Zelda occasionally, like after Charlie went to bed. But that was the
Yeah.
last time. And now that he's older, like after they go to bed, like we're usually, catching up on shows or just going to sleep. So we really we haven't played anything. I don't think we've even connected any of like our game systems here. Jake we have the Nintendo, what is it? Nintendo Switch. We have that. Jake has an Xbox, but I don't think we've even connected them. Because now too, like if we were to play when the kids are awake, there's no way Charlie would attack the controller and try to play with it.
Yeah, I never understand how people could pull that off. Even right now with babies, I mean, yeah, it's we've got two of them, so it's a little any even going to the bathroom is difficult. But
and even when they're asleep, like there's so many other things you have to do that you don't have time to do when they're even just taking a shower, like when once the boys are both in bed, like that's when I can take a shower.
Yeah.
I'm just so tired. There's been many times I've booted up the system. I look at it for like 5 minutes and I cut it off and go to bed because I'm like, I can't do it right now.
Because you realize it's the cost versus the gain. Like, yeah, it would be fun, but anytime, like you said, I try to do it, I'm just like, what am I doing? Like, they're gonna be up in 3 a.m, and it's like you got to try to sleep now or get the dishes done or shower, whatever. But maybe 20, 30 years from now, we'll all be back. The Xbox servers are gonna be popping back off. We'll get
Well, I'm
Jake in there.
excited for when Charlie's a little bit older. Well, both the boys, but Charlie will be there first to play like Mario Kart or like some of those older games with him. I think will be fun.
I know Robbie was playing, and this is, our listeners might be gone by now, but Robbie got Mario Party with his kids.
Oh yeah, that was fun.
And he said there was screaming and crying within the first 5 minutes because somebody lost a mini game or something.
Yeah, lots of tears. Remember, our youngest brother Rob we were probably all sore losers at different points, but when he would lose, he'd like screech and throw the controller.
Yeah.
Always some tears.
Yeah. Good times though. If I could go back, I'd still whoop his ass in those games.
Yeah.
But all right. We won't keep you any longer with our rambles.
All right. Yeah, I was just
Well,
thinking when you said that the girl's getting up at 3 in the morning, I was like, oh, it's already almost 11 here. Louis probably going to be up in like an hour. So.
yeah. Yeah, I'm gonna go see what's going on out there. I know Lauren was working on a few things, but she might be in bed. I'm not sure. I hope she's in bed, but a lot of times she stays up to kind of see how the podcast went. But
Mhm.
you know,
Well, if she's still up, tell her I said hi, and I'm excited to see you guys in a couple weeks, 2 weeks.
yeah, that's gonna be a blast. And then
Mhm.
maybe next time we have you on the show, we'll probably have a few stories from this upcoming trip
I'm sure.
when Mom gets arrested.
Yeah, I'm a little worried for that, but we'll see what happens.
But all right,
All right.
It's-
Thank you,
thanks
guys.
again for
talking
doing
with you.
this,
All
and
right.
Never
have a
got
good night.
caught,
All right, have a
they
good night.
just drifted away. Two names whispered at the end of the day. Now they sit in the dark with their own private grave, telling tales no one believes, Nick and Dave. Yeah, truth is a ghost when the legends are made, and the last ones left are just Nick and Dave.